Ladies and gentlemen, welcome back to another episode of MedSynapse podcast series, your go-to podcast for all things medical. I'm your host, Dr. Nigar, and today we have a special guest joining us, Dr. Rami Darwazeh, a quadrilingual neurosurgeon with a wealth of experience and expertise spanning over a decade in the field. Dr. Rami brings a unique perspective with 11 years of practice and 5 years of post-qualification experience, specializing in the diagnosis and treatment of various neurosurgical and spine diseases. Dr. Rami's journey into neurosurgery is nothing short of remarkable. His thirst for knowledge led him to pursue 4 fellowships across Germany, China, and Jordan, honoring his skills in skull-based surgery, cerebrovascular surgery, and neuroendoscopy. But what truly sets Dr. Rami apart is his relentless dedication to advancing the field with particular expertise in traumatic brain injury, brain tumors, skull-based surgery, spine trauma, and spinal tumor surgery, also cerebrovascular surgery, and pediatric neurosurgery. Dr. Darwazeh has been at the forefront of groundbreaking research and innovation. Furthermore, Dr. Rami's passion for education and collaboration is evident in his creation of the Neurosurgery Quiz Group on Telegram, boasting over 2,000 members. Through this platform, he fosters learning and engagement among fellow neurosurgeons worldwide. Today, we have the privilege of delving into the world of brain tumors with Dr. Rami. We will be exploring the latest advancements in tumor removal, the role of precision medicine, and the challenges faced in the operating room. So without further delay, let's dive into this enlightening discussion with Dr. Rami Darwazeh. Welcome, Doctor.
Hi, good morning. Thank you for your introduction and thank you for having me.
Thank you so much, Dr. Rami, for being here with us on this very important topic. It's an honor to have you on our medical platform today.
Yeah, thank you.
But before we dive into our podcast, I'm very keen to know about what drew you to pursue a career in neurosurgery.
Well, that's an interesting question. Actually, many factors. One of them was actually my father, my dad, who's a consultant neurosurgeon. Since I was a child, my dad used to take me to the hospital and sometimes allow me to observe his operations in the operative theater. And I think from doing so, I developed a passion for neurosurgery to understand the brain function, its anatomy. And also, I am keen to help patients who are suffering from neurological diseases that need neurosurgical intervention.
Thank you so much for sharing your personal journey with us, Dr. Rami. It's fascinating to hear about the passion and dedication that you have in the neurosurgery field. Now, let's begin with our podcast. Dr. Rami, to begin with, what are some of the latest advancements in surgical techniques for removing the brain tumors, and how do they compare to traditional approaches?
Well, that's an important question. We live in a modern era, and there have been a lot of developments in a matter of techniques and tools in regarding neurosurgery. One of them is what we call the minimally invasive surgery. For example, it's a surgery which uses the endoscope or a keyhole surgery that does not require a large incisions like it was done, let's say, 30 to 50 years ago. In this manner, you're achieving a less trauma to the tissue and achieving better patient recovery, less blood loss, and patient can be discharged earlier from the hospital. Another thing is the image-guided surgery. It's basically a neuronavigation system or intraoperative MRI that can help the surgeon to visualize the tumor margins and to achieve a more accurate surgical resection. Also, one of the new tools used in this era is a robot-assisted surgery. Basically, it's a robot that functions as an assistant surgeon in performing a delicate procedure, and it's mainly used in tumors that are hard to reach, are deeply located in the brain. So robot-assisted surgery is very helpful. Also, laser surgery is a very advanced surgery and technique, which basically uses a laser energy to destroy tumor cells and to coagulate the tissue. It's mainly used for tumors that are highly vascular. In this case, you can minimize blood loss and achieve better tumor resection. Of course, let's not forget about the awake brain surgery, which used in very selective cases. Cases like those cases like a brain tumor close to the eloquent brain area, like a speech area. In these cases, the patient initially put asleep under general anesthesia. After the neurosurgeon reaches the brain tumor that is close to that critical area, the anesthesiologist will bring the patient back and awaken the patient under, of course, sedation. And there will be an assistant who will continuously be communicating with the patient while the neurosurgeon be removing the brain tumor. So in case if the neurosurgeon get close to eloquent area, the assistant can notice a difficulty in patient's speech or slurred speech, and he can immediately notify the neurosurgeon and he can stop resecting in that area.
Thank you, Dr. Rami. It's fascinating to see how surgical techniques have evolved to become less invasive while still maintaining high levels of effectiveness, especially when it comes to brain tumors, offering patients better outcomes and definitely shorter recovery times. Now, moving on to our next question, could you please discuss the role of precision medicine in the treatment of brain tumors, particularly in tailoring surgical approaches and post-operative care to individual patients?
Yes, indeed. Every case is a special case. It must be tailored according to the location of the tumor and according to the vital structures that are surrounding the tumor. Of course, before any case, the preoperative planning is very crucial. It's very important. Reading the preoperative MRI images are very important. You can use some advanced imaging techniques like functional MRI and DTI, which stands for diffusion tensor imaging. These techniques are used to map critical brain regions and neural pathways. By knowing that, the surgeon can make a safe approach to the tumor in order to completely resect that. Also, preoperatively and intraoperatively, we use the neuronavigation system. It's a complex system which precisely guide the surgical instrument. It can help you plan your skin flap, your bone flap, and mark the margins of the tumor in order to achieve complete resection and safe resection of the tumor. Also, almost in all our brain surgeries, we use the intraoperative monitoring. It's basically a real-time monitoring, continuous monitoring of neurological functions during surgery. So if, for example, there is a tumor that close to the facial nerve, the preoperative monitoring will be conducted, and during the operation, there will be a technician that continuously will be monitoring the function of the facial nerve. So in case the neurosurgeon are working close to that nerve or stretching or start causing any damage, the technician can see it on the monitor and immediately notify the neurosurgeon, and basically the neurosurgeon can stop in order to not damage the nerve. Also, as I earlier mentioned, minimal invasive approaches like endoscopy and robot surgery help the surgeon to achieve complete resection of the tumor, safe resection, and having a better recovery for the patient.
Dr. Rami, how do you approach the delicate balance between removing as much of the tumor as possible while preserving the neurological function during the brain tumor surgeries?
Well, this is a difficult question every neurosurgeon faces. It's very important, like when you go for the operation, that your state of mind is to achieve gross total resection, complete resection of the tumor. But of course, it's not always possible. Sometimes the tumor is engulfing or invading some critical structures like major vessels or cranial nerves. In this case, you may require to leave a small remnant of the tumor in order not to cause damage. Now, for that remnant, it can be treated by radiotherapy, like radiosurgery. We have a lot of advanced tools like gamma knife, cyber knife that can target the remnant of the patient. In this way, of course, you are improving the quality of the life for the patient, and at the same time, you are achieving complete resection and preventing tumor from recurrence. As I said, every case, every patient is a special case. It must be tailored. Preoperative planning, careful planning must be done. The new imaging and advanced imaging techniques must be used and examined carefully. Intraoperatively, you may need to use all the available tools from neuronavigation, operative monitoring, and other tools in order to help you to achieve tumor resection. And finally, neurosurgery, it's basically a multidisciplinary team. It's never about the surgeon. It's always a team of neurosurgeon, neurologist, the anesthesiologist, and the other specialists, including the nursing team, that all work together in order to achieve the best outcome for the patient.
Definitely, Dr. Rami. That must be very challenging. But by considering the unique makeup of each tumor and the patient, I believe that neurosurgeons can optimize the treatment strategies and potentially improve the outcomes while definitely minimizing the side effects. Now, moving on to our next question, what are some of the most challenging types of brain tumors to operate on? And how do you and your team overcome these challenges in the operating room?
Well, in neurosurgery, we never say there is an easy operation. Almost every operation is complex and every operation needs sophisticated and preoperative planning. So we use all the new technologies that I mentioned previously, from neuronavigation, intraoperative monitoring, and all the intraoperative tools and techniques in order to achieve gross total resection of the tumor. Also, we use the new technology in cases of the aggressive tumors like GBM, which are till now are the very challenging tumors, because no matter how you dissect the tumor and you follow it with chemo and radiotherapy, the tumor reoccur. However, there are many new therapies that on the horizon, for example, like immunotherapy, like CAR T cells therapy, that uses the patient's own body immune system in order to target the tumor cells. Also, gene therapy is it's a hot topic of study that uses modifying genetic material in order to inhibit tumor cells and they cause cell death. Nanotechnologies are also out there. It's basically using a nanoparticles to visualize the tumor and to target those cells and cause tumor death. And all of these new technologies are used on each case and carefully selected in order to remove the tumor and completely dissect it and achieve good prognosis.
And lastly, Dr. Rami, could you please share some insights into how you approach patient education and supporting the patients post tumor surgeries?
Well, that's also an important question. Patients' education is very significant. Post-operatively, you guide the patients how they can proceed following surgery. From patient to patient different, some of them having a little bit of depression by just knowing that they underwent a brain surgery. So we assure them based on our intraoperative findings and how the operation went that everything is fine, and we will be following their case closely. Will be patients for the first year will come back for an MRI scans in order to see the progress if there is any recurrence of the tumor. Also, sometimes we ask the patient to closely monitor if any symptoms develop, like persistent headaches, seizures, or any weaknesses, or any cognitive or memory problems, which can indicate recurrence of the tumor or an ongoing pathology. In this case, we ask the patients to immediately return to us so we can do further evaluation and examination.
Definitely, Dr. Rami. I believe that understanding the recovery process and the ongoing care is very crucial for the patients and their families to ensure that they are well informed and supported during this critical period for them.
Yes, of course. Yes, there are also some leaflets we provide to the patient how to monitor them themselves, and we ask him after the operation to return every other day for wound dressing, and we'll be observing the wound closely to see if there is any signs of infection and how the wound is healing. Also instruct the family to watch for the patient in case if they developed any seizure attacks or drop attacks. So patient and family education is very crucial, and we always ask the patient to keep in touch with our team and the surgeon in case if they have any questions, in case if they encounter any new symptoms, in order to manage it promptly.
Thank you so much, Dr. Rami, for sharing the strategies that you use to empower your patients and their loved ones as they navigate through this journey of recovery.
Thank you.
And before we wrap up, Dr. Rami, I want to extend a sincere thank you for sharing your expertise and insights on this very important topic of brain tumor and its surgery with us today. Your willingness to share your knowledge is truly commendable, and your expertise has provided us with a deeper understanding of the complexities involved in brain tumor surgery, and we're very grateful for your contribution today. We look forward to hearing more from you in the future.
Thank you very much, and thank you for having me.
And to our audience, thank you so much for tuning in to this enlightening discussion on MedSynapse. We hope you found it as informative and engaging as we did. Stay tuned for more insightful conversations in the future. Take care and goodbye.